Is your heart 100% healthy, or have you felt something unusual? When the heart starts to become unhealthy, it can give you some signs that something is about to happen. Not many people are aware of this, but it's important to stay vigilant. About a week before a heart attack, we can notice some warning signs and symptoms. That's why it's extremely important to recognize these symptoms in order to try to prevent a heart attack in the coming days. In this video, I'm going to share with you the 8 most common symptoms that typically appear 1 week before a heart attack. Be careful, as these symptoms can go unnoticed. First, go ahead and give this video a thumbs up and subscribe to the channel. Let's make this the most liked video on the channel ever. Have you ever suffered a heart attack? What part of the world are you from? After you've watched the video, drop a comment below so we can get to know each other better. Now, let's take a look at the 8 main symptoms that may indicate a heart attack 1 week before it happens. 1. Chest pressure or pain. Pressure or pain in the chest is one of the main warning signs before a heart attack, affecting about 2/3 of patients. It is characterized by a sensation of pressure and pain in the center of the chest, which can radiate to the left arm, back, or jaw. This sensation occurs intermittently, with episodes that come and go in the days leading up to the heart attack. Cardiac pain is often accompanied by other important symptoms, such as cold sweat, nausea, and vomiting. When you feel this kind of tightness or burning pain in the chest, especially if it radiates and comes along with these symptoms, it is crucial to seek medical attention immediately, either at a hospital or with a cardiologist. 2. Dizziness. Dizziness can be a warning sign for an imminent heart attack, as it indicates that the heart is not pumping blood adequately to the body, especially to the brain. These episodes usually last a few seconds and are recurring, persisting for days until the heart problem is treated. When sudden dizziness occurs without an apparent cause, especially if accompanied by other symptoms, it is essential to seek medical evaluation immediately, as it can even lead to fainting in severe cases. 3. Abdominal pain. Abdominal pain can be a symptom of an impending heart attack, manifesting as brief and sudden episodes over several days. Unlike common digestive pain, this pain is caused by vascular problems resulting from poor heart function. These episodes are characterized by sudden pain that disappears after a few minutes. 4. Extreme fatigue. Abnormal fatigue, known as anginal equivalent, is an important warning sign of heart problems. It manifests as disproportionate fatigue during activities that were previously performed without difficulty. For example, becoming breathless after walking 300 meters when previously walking 2 to 3 kilometers without problems. This fatigue often comes with chest tightness and breathing difficulty, even without typical chest pain. When there's this significant reduction in exercise tolerance, it's crucial to seek cardiac evaluation. 5. Breathing difficulty. Difficulty breathing is an important symptom that can precede a heart attack by several days. It's characterized by shortness of breath, often accompanied by coughing and palpitations. This occurs due to the close relationship between the pulmonary circulatory system and the heart. When the heart doesn't function properly, it can lead to pulmonary edema, causing these respiratory changes. 6. Palpitations. Palpitations are a symptom that can indicate heart problems, manifesting as the perception of heartbeats at rest. It can be a sign of a heart arrhythmia, an irregular rhythm between the atrium and ventricle, often caused by obstructed coronary arteries. In more severe cases, when arrhythmias are frequent, the heart can tremble instead of beating normally, reducing blood flow to the brain and causing dizziness or even fainting. Anyone who experiences palpitations, especially if accompanied by dizziness or fainting, should seek cardiological evaluation immediately. Before we continue, I've got some exciting news to share. If you want to get more engaged I'm excited to inform you that we now offer channel membership. As a member, you'll pay a small monthly fee and unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. It's a fantastic way to support the channel and connect with us even more. Just click the join button and let's make this experience even better together. 7. Swelling. Swelling in the lower extremities of the body, including the legs, ankles, and feet, can be an important sign of circulatory problems. When the heart cannot pump blood adequately, there is a buildup of fluids in these areas. This symptom deserves special attention when it appears suddenly or intensifies, as it may be related to a developing arterial blockage. In some people, this swelling can occur in the weeks before a heart attack, serving as a warning sign to seek medical evaluation. 8. Extreme sweating. Extreme sweating, especially cold sweat unrelated to physical exercise or the temperature of the environment, can be a warning sign of an impending heart attack. This symptom is more common at night and affects about 30% of people who will have a myocardial infarction. It is important to note that excessive sweating rarely occurs alone. It is usually accompanied by other warning symptoms, such as abnormal fatigue and breathing difficulty. The combination of these symptoms should be considered a signal to seek immediate medical care. But what exactly is a heart attack, and why does it occur? A heart attack happens when a coronary artery becomes blocked. The heart has three main arteries: the right coronary artery, the circumflex coronary artery, which wraps around the back of the heart, and the left anterior descending artery, which is the main artery responsible for supplying almost 50% of our heart. Acute myocardial infarction occurs when one of these three main coronary arteries is blocked. This process, called atherosclerosis, begins at birth with the gradual accumulation of fat in blood vessels, especially in the coronary arteries. Over time, this blockage can reach 70%, causing instability in the vessel wall. When the vessel wall ruptures, platelets and clots aggregate, causing a complete blockage of the artery and resulting in a heart attack. If there is no rapid clearance of the blockage, the lack of blood supply can cause the affected heart muscle to turn into scar tissue, or fibrosis. The atherosclerosis process is primarily accelerated by lifestyle factors and medical conditions. Sedentary behavior, obesity, and stress, combined with risk factors such as high blood pressure, diabetes, smoking, and abnormal cholesterol levels, high LDL, low HDL, and elevated triglycerides, accelerate the accumulation of fat in the arteries, significantly increasing the risk of a heart attack. Heart attack symptoms can vary from mild chest discomfort to intense pain, and they can be different for everyone. If you think you might be having a heart attack, call 911 right away or your local emergency number. If you can't reach emergency services, ask someone to drive you to the hospital. How to prevent a heart attack? To prevent a heart attack, it's important to embrace a heart-healthy lifestyle and manage key risk factors. Eating a balanced diet filled with fruits, vegetables, and whole grains is crucial. On our Instagram, we have a post about the 10 best foods for a healthy heart, so make sure you check that out too. Be sure to follow us on Instagram for exclusive health tips and extra content. Also, regular exercise can greatly lower your risk. Try to avoid long periods of sitting and incorporate movement into your day, even if it's just standing up occasionally. Keeping a healthy weight, avoiding smoking, and limiting alcohol consumption are also essential. Regular health checkups to monitor cholesterol, blood pressure, and blood sugar levels are crucial, since these can lead to heart disease if not managed. Have you or anyone you know ever shown any of these symptoms before a heart attack? Share your experiences in the comment box below. If you found this video helpful, please type yes in the comments below. I also encourage you to check out these 2 videos we selected especially for you. Thanks for watching.